My name is Sheila, and I'm a CPA. I have a husband and a daughter, and we just like doing things together. We spend all our time together. 20 years ago, I began experiencing symptoms of Crohn's disease. Actually, my husband, we were dating at the time, and he was like, Sheila, there's something wrong with you. I realized it was time to go to the doctor, and he referred me to a gastroenterologist who did a colonoscopy and other testing, and so then I was diagnosed with moderate to severe Crohn's disease. At that time, a very common treatment was steroids, and so I was on and off of steroids for probably a decade. Other medications, we would try them, and I would have limited success. I tried to stay optimistic. I graduated college, established a career, and gave birth to my baby girl. After I had my daughter, 11 years ago, I had a really bad flare-up. It was by far the worst that I had had, and I was put on another drug, and I was on it for 4 years and had pretty good success. But then at about 3 to 4 years, I started developing side effects, and so I had to be taken off of that drug. So after that, I had surgery. They cut out my ileum and 1 foot of my small and 1 foot of my large intestine. I was good, but it only lasted 2 years. So then 2 years after surgery, I was in the same position I was before. I thought I was running out of options. So my doctor recommended I try ENTYVIO. Over time with ENTYVIO, I started to have improvement, and I've been diagnosed to be in clinical remission. If you have been diagnosed with Crohn's disease, one of the best things that you can do is pay attention and learn about your disease and yourself, because everyone's different. I've learned to take one day at a time. I visit my gastroenterologist regularly, and I take my medication. You have to have a good relationship with your doctor. People should know that there are options, and they should talk to their doctor. I learned very early on not to hide from being sick. To me, all you can do is find what works for you and follow your treatment. And don't be afraid to talk about it, especially with your family. You have to have a positive approach and take one day at a time.
ENTYVIO is a prescription medicine used in adults with moderately to severely active ulcerative colitis or Crohn's disease when certain other medications have not worked well enough or cannot be tolerated. Important safety information about ENTYVIO, vedolizumab. Do not receive ENTYVIO if you have had an allergic reaction to ENTYVIO or any of its ingredients. ENTYVIO may cause serious side effects, including infusion-related and serious allergic reactions can happen while you are receiving ENTYVIO or several hours after treatment. You may need treatment if you have an allergic reaction. Tell your healthcare provider or get immediate medical help if you get any of these symptoms during or after an infusion of ENTYVIO: rash, itching, swelling of your lips, tongue, throat, or face, shortness of breath or trouble breathing, wheezing, dizziness, feeling hot, or palpitations, feel like your heart is racing. ENTYVIO may increase your risk of getting a serious infection. Before receiving and during treatment with ENTYVIO, tell your healthcare provider if you think you have an infection or symptoms of an infection, such as fever, chills, muscle aches, cough, shortness of breath, runny nose, sore throat, red or painful skin or sores on your body, tiredness, or pain during urination. People with weakened immune systems can get progressive multifocal leukoencephalopathy, PML, a rare serious brain infection caused by a virus. Although unlikely while receiving ENTYVIO, a risk of PML cannot be ruled out. PML can result in death or severe disability. There is no known treatment, prevention, or cure for PML. Tell your healthcare provider right away if you have any of the following symptoms: confusion or problems thinking, loss of balance, change in the way you walk or talk, decreased strength or weakness on one side of the body, blurred vision, or loss of vision. Liver problems can happen in people who receive ENTYVIO. Tell your healthcare provider right away if you have any of the following symptoms: tiredness, loss of appetite, pain on the right side of your abdomen, dark urine or yellowing of the skin and eyes, jaundice. The most common side effects of ENTYVIO include common cold, headache, joint pain, nausea, fever, infections of the nose and throat, tiredness, cough, bronchitis, flu, back pain, rash, itching, sinus infection, throat pain, and pain in extremities. These are not all the possible side effects of ENTYVIO. Call your healthcare provider for medical advice about side effects. Before receiving ENTYVIO, tell your healthcare provider about all of your medical conditions, including if you have or think you may have an infection, or have infections that keep coming back, have liver problems, have tuberculosis, TB, or have been in close contact with someone with TB, have recently received or are scheduled to receive a vaccine, or if you are pregnant, breastfeeding, plan to become pregnant, or plan to breastfeed. Please see accompanying full prescribing information, including the medication guide for ENTYVIO, and talk with your healthcare provider. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Uses of ENTYVIO, vedolizumab. ENTYVIO is a prescription medicine used in adults for the treatment of moderately to severely active ulcerative colitis, moderately to severely active Crohn's disease,